My name is Dr. Sean Convoy. I am a psychiatric mental health nurse practitioner. I'm the lead faculty for Duke University's Psychiatric Mental Health Nurse Practitioner program. I think it's important to note that all programs across the country, they're all framed across the same set of standards. You know, the American Association of Colleges of Nursing has a Master's Essentials, and the National Organization for Nurse Practitioner Faculties have their competencies. So all programs are the same in terms of the content. So it's not so much about the what as it is about the how. So what we do differently, and this kind of distinguishes us from, I would argue, almost every other university in the country. We apply simulation, both high and low fidelity simulation, with every specialty course in this program. It's not enough just to give students required reading and lectures and discussion board activities and tests. You have to have something that galvanizes their skills. And we find that simulation that we do face-to-face here on campus, but also via a telepresence when they're at home, really does a better job of galvanizing those skills. So a big distinguishing feature for us is, one, simulation. Two, you may or may not be aware that nationally we have a big problem these days with opioids. It's a national emergency, and 2 years ago the federal government authorized advanced practice nurses to be able to prescribe medications to treat this condition. And what typically happens with students is they graduate their programs, they get out to practice, then they begin the process of getting all the requirements done in the training for that. It's called buprenorphine wafer training. We require that in the program. So before our students even graduate and are board certified, that training is complete. That distinguishes us. Another thing that's interesting is right now nationally, the amount of mental health assets are not equitably distributed across the country. They are concentrated in the Northeast and in highly populated cities across the country. That creates a problem in terms of access to care. So one of the challenges that's been kind of driven at the organizational level for mental health is to kind of make sure we're giving skills in terms of telepsychiatry. So we build telepsychiatry into our program. Not only are the students required to get that telepsychiatry certification, but a big part of their simulation experience is done via telepsychiatry. So we're doing it face-to-face as well as from a distance perspective. It's giving them additional skills. The last piece of this that I think distinguishes us, and one of the big problems also nationally is that we have this big problem with polypharmacy. There's too many medications being prescribed and not a lot of it's necessarily wrapped around the evidence. The reason why I think that happens to some degree is kind of how we train our people. If you think about what a psychiatric nurse practitioner does these days, is the system really wants that individual to prescribe. And while that's obviously a critical piece of our job, it's not the sole piece of our job. And what I find is if schools train their people to value or overvalue prescribing, it's kind of like you're giving them one tool. And if that one tool is a hammer, everything looks like a nail. So what we do alternatively is we help these individuals develop a balanced set of skills, where not only are they getting skills to prescribe effectively, but they're also getting really well-developed psychotherapy skills that, again, we galvanize in simulation. So those four pieces: simulation, buprenorphine waiver training, telepsychiatry certification, and a balanced set of skills both psychotropically and psychotherapeutically. Duke brings in kind of two different paths to get to the psych nurse practitioner certification. One approach is to come in as a postgraduate certificate, right? These individuals are already established as an advanced practice nurses, and they come in to get the additional skill set for psychiatry. The other pathway is through a traditional master's degree after you've had a bachelor's degree. So this cohort that we're graduating, it's an inaugural cohort. They are postgraduate certificate students. So they're already established adult and family nurse practitioners. And what they're doing now, they'll graduate this spring. One of them is out in the rural areas of Nevada, where there is not another mental health asset in 250-mile radius. He's already working to build a really robust telepsychiatry practice in that area to cover the entire northern part of Nevada. He's also been working already with their local legislators to kind of improve practice acts. So one person is going to jump deep into psychiatry. Another person is in a federally funded Medicaid clinic down in Florida, and she actually is considering her options, but she still has some obligations. So she's going to be actually doing embedded behavioral health in that federally funded primary care clinic. We have one other individual that is here locally, and she is looking at her options. She's got some offers in terms of a embedded behavioral health asset in the primary care clinic, but also is looking at the VA. So all these individuals have had some pretty robust experiences. One of the great things that we have here at Duke is a clinical placements office. We don't want our students putting all the necessary time and work to set up their own preceptorships. That's our job. And quite frankly, Duke students pay a premium dollar for that additional resource. So these students had the opportunity to not be distracted by placements, get the hours, get the experience, and now they're all getting job offers that are pretty remarkable. I guess, one of the, and this kind of goes back to philosophy, one of the unique things about this program, one, right now it's relatively small. The N of students isn't really big, which allows us the opportunity to provide some individualized support to these people. I kind of don't see a cohort of students coming through a program. I see a bunch of individuals that I have to kind of individualize the education to. I'd encourage anybody who's interested in this, it's important for me that you understand that this is a fit. There has to be a right fit, and I want you to have informed consent when it comes to this program. So you have to do your due diligence. You have to get online. You have to look at the website. You need to reach out to the resources that are available on the website. Somewhere along that process, it's going to eventually end up you connecting with me, and then we're going to have a discussion. I just don't want you to be, a run-of-the-mill psych NP. This program is unique, and it's got to uniquely fit you. So this is really kind of a personalized fit.